view on that, because I think there is also maybe some heterogeneity in the perception within EFPIA. Yeah? I would agree that in the best case, yeah, screening and medicinal chemistry follow-up activities have to be very closely linked to each other. Yeah? Feedback or screening needs the feedback coming from chemistry evaluation of hit lists to adapt their strategies in screening. Giving you an example, if you have let's say a serine protease, yeah, and you screen that and you find only reactive compounds, the next screen on a serine protease has to account for that, and you have to get rid of these artifacts in an early stage to improve your screening processes. It's only one simple example how important that feedback from chemistry evaluations is for adapting screening. That's why I would agree in the best scenario that might be closely linked with each other. But the views are different. So are the views probably of the reviewers later on. Yeah, you can make an argument in your application that this would be the best way to go. In the end, it's going to be this reviewing panel that Hugh has introduced that is going to make the judgment. How valuable do they think this argument is in selecting the winning consortium? Yeah, I would be on your side.
So we have a question at the back.
Jörg from VIB. I just had a question on the second shell. So once this whole program is up and running, yeah, an academic drug target can be selected based on a competitive review and is taken up. I'm just curious, at the end of that, so there is this exclusivity period which is mentioned in the document, but how is it going to play out? Who is the owner, and what are the early access rights you were referring to? Is that a first right of refusal? Is that a... Can you comment on that? How will that play out?
Well, it's also clearly a topic for a full project proposal. Yeah? That has to be negotiated by the different parties involved. I can give you only my views, and it wouldn't make sense at this point in time. I think this is really one of the core tasks of the full project proposal, to clarify all these issues which are prominently or very relevant to this entire proposal. Yeah.
Okay, I think Michael here as well can make a point in this issue.
Yeah. Even if most of the issue will have to be discussed when preparing the full project proposal, you should keep in mind that basic principles have been already set up at IMI in general, which apply to all IMI projects. And in terms of ownership, as mentioned this morning, everything generated within a project will be owned by the one who generated it. And in terms of access right, as also shortly mentioned this morning, some of them will have to be mandatory granted for the implementation of the project, but also for further research. Of course, the condition under which this access right will have to be granted will have to be negotiated within the consortium, but as such, the principle of granting access right is already set up. Not necessarily, no, because some of the access right may be granted for commercialization purposes. But all these access rights are granted on a non-exclusive basis, but it doesn't imply that it will prevent for commercialization.
So if on a public target a nice compound is found, all the EFPIA partners or the consortium partners basically have non-exclusive access rights to those? Who's going to invest for clinical trials on that?
It may be one of the partners or third parties to the consortium, depending on the one who will have the resources and the capacities, the abilities to ensure this commercialization.
Knowing
but this will have to be discussed within the consortium.
Knowing they don't have exclusive access to the compound, patent.
No. The patent is different from the access. The patent is the one who owns has generated and who will file the patent. The access right is the step after. And the access rights are granted on an exclusive basis. Because you have also to grant, you still have to grant access right to other partners for different purposes. That's the reason why. If you would like, you may consider a quasi-exclusivity if you really define the field in which the access right will be granted. But it cannot impact on the access rights that will be needed, as an example, for implementing the project, if these access rights are granted at the same time than the implementation of the project, or if access rights have to be granted for further research. But we cannot really consider that you will grant exclusive access right. You could consider quasi-exclusivity, because you clearly define the field and which will not impact on the project objective.
Magali, can I add to that? I'm Christopher Brugge, Janssen Pharmaceuticals, and I'm one of the attorneys involved in the drafting of this call. I think we're trying to arrange too much here. I think the example you give is a typical example where a new target is brought in by a public partner. So that partner will own that as background. If the partner is newly developed, he will have developed it newly. It's his foreground. The hit will be found with a compound from someone else, but that's practically where the consortium or the project ends. After the 5 years, you will then have to settle between those two owners how you will pursue such an interesting activity, lead optimization, negotiate for who of the two partners would take commercial rights, and then you can go for an exclusive license. But the basic principles is there are the IMI rules, which are set for everyone, that protects your ownership, and that arranges for minimal access rights for all the parties for research use in a non-exclusive way. But if someone wants commercial rights, okay, then you have to start negotiating.
Okay. Thank you.
Okay, so we have a question here.
I would like to, my name is Nikolaus Sachel, I'm coming from Vienna from a screening center. I would like to come back to the quantitative tasks you mentioned in your presentation. That is 2 times 24 high throughput projects, which leads me to first to discuss the beginning and then to discuss the end of such a project. Who selects the target? Do you have standards? What is a sufficiently validated target? And who decides on the selection of the targets? And at the end point, when is a highest throughput screening completed? Do you have an idea for that, or do you expect proposals? Also in this regard.
Let me start with selection of targets. It will be one job of the full project proposal to come up with a governance structure, and also structures and definitions of all the processes involved. That also includes this particular selection process. In the text, we envision that this will be steered and governed by an advisory board that is on top of the lead factory, and that ensures also this preference of projects that are likely to be partnered by EFPIA companies. The validation of targets, it's exactly about taking more risk here. So there will be no clear definition on a validation. It's going to be an exciting, novel idea and trying to convince that decision-making board to go forward. It's about taking more risk here in this approach rather than the typical pharma way, trying to have a risk-balanced portfolio there and trying, in most cases, to avoid exactly that risk. So we will see a lot of risky projects. When do we come to an end? I think what's also pretty clear here in this context is, since we somehow limit the drainage and outflow, if you want, of information coming from this protected library, semi-protected library, if you want. We will see also a couple of projects where the medicinal chemistry view and also the expert screening view will come to the conclusion there is nothing that provides a meaningful starting point to go on with any kind of activity.